Hi, I'm Mina Malik Hussain and you're watching The Coffee Table. As you know, we love to have doctors on the show because we have so many questions about our health and about your health, and I think that you guys learn so much from the wonderful people that we have on the show. So today we thought about this a lot, and then we decided that we are going to talk about our bones, and we're going to talk about our kidneys, and we're going to talk about uric acid. And I think that it's a sort of topic that it's become much more prevalent and much more common in the past few years, I think. But we have two doctors on the set to tell us yay or nay, and to just talk to us about what is the problem, how do we deal with it, what are the treatments, what are the myths, and this is going to be very fun. So joining us today on set is Dr. Khalid Hussain, who is an orthopedic surgeon who practices at Doctor's Hospital. And we've got Dr. Irfan Nazir, who is a urologist and the head of the urology department at Shalimar Hospital, and he also practices at Doctor's Hospital. And no, we didn't just go to Doctor's Hospital to do a raid on their doctors. Thank you, and hello and welcome to the set, doctors both. Thank you for taking out the time.
You're welcome.
We're always very aware that, we're sort of snatching doctors away from, their clinics and their operating theaters. And that Dr. Khalid says that he's just come out of surgery to be on the show. Thank you very much.
Yes.
I always find it so fascinating, that it's so sort of intense and you're in an operation theater and you got your scrubs on. I watched a lot of medical TV shows. And then, it's like you do these procedures and then you come out and you take off your scrubs and you're just a normal person.
Because it is just our routine.
Yes.
It is our routine. We start morning with an operation theater and end at night after surgery.
Oh my gosh.
So whole day, patients, whole day, surgeries, this is our routine.
Yeah, and it just feels so tremendous, that just sort of cut things up. And with bones, like you have to do saws and things as well.
Yeah.
Because it's bones.
We have to use saws, we have to use blades, we have to use tails, we have to use wires.
Hammers?
Yeah.
And screwdrivers.
Oh my gosh. I'm sort of fascinated and horrified at the same time. Dr. Irfan, do you do surgery?
Yes, I'm a urologist. I do surgeries for the kidneys and the bladder, the prostate, the stones. Yes.
All the sort of, south from the belly button.
Yes, definitely.
Oh gosh, but this is really fascinating. I'm really fascinated by doctory all the time. But now we must focus on uric acid. So Dr. Imran, tell me, so many people now seem to have uric acid problems and issues with it. So sort of what is uric acid to begin at the beginning?
Basically, uric acid is a compound which is present in the body.
Yes.
And basically, what happens is, and there are two kinds of uric acids.
Okay.
One, for simplicity, is called as uric acid, which crystallizes and sediments in the body.
Okay.
The other is a more soluble component, which is known as urate.
Urate, okay.
Yes. Now, urate is something which easily dissolves in the urine and is excreted out. Now, uric acid is something which is dangerous.
Right, because it doesn't go anywhere.
It doesn't go anywhere. It sediments.
Right. Which means that it settles down.
Settles down. And where it settles down, it is very difficult to eradicate it from there.
Oh.
You can understand by one simple analogy that there's one uric acid crystal, then another one settles down on top of it. Finally, they form something which is called a tophus.
A tophus.
And you can imagine if you have some crystals in your joint, in your kidney, then what is going to happen to that joint or that kidney?
And a tophus is not a sort of nice, round, smooth thing.
Not.
A crystal is a spiky thing.
It's a spiky thing which does not let what is supposed to be done by something happen.
Oh dear, so it sounds like a very annoying relative, that they get in the way, they're very difficult, they cause trouble, and they don't go anywhere.
They don't go anywhere, and once it forms, it's very difficult to get it out.
Oh gosh, so the joints are one place where it's very common for tophuses to...
Tophi are commonly found in toes, joints of the toes, in ankle joint, in joints of the hand, elbows. These are sites where tophi are usually found.
Right. Knees.
Later.
They can be in knees, but
but it's generally a smaller joint.
They can be in any joint, but mostly they are found in these joints which I have already told.
The common ones, and the ones where they're causing the most trouble because your feet and your hands you're using all the time.
Because you are having a big swelling at your elbow, with the hard tophus inside.
Right.
So it is a problem for you. And wherever these tophi are, there is inflammation, there is a swelling, there is a redness, there is hot area, there is severe pain.
It feels hot as well.
Yeah.
So it's not just a myth that if your relative grandmother is saying that it feels really hot, but it's actually hot. Why is it hot?
Because the blood circulation increases there.
Yes, because of the inflammation.
Yeah, there is inflammation. So inflammation signs are these redness, hot, swelling. These are signs of inflammation.
And all of this, but inflammation, is that a sort of late stage situation where it becomes so visible on the outside?
No. Inflammation due to uric acid crystals is not that late stage.
Oh, okay.
That can start earlier, and that can alarm you at night. While you are sleeping at night, there is a severe pain in your big toe. You see there is a swelling, there is a redness, there is you cannot move that. There is loss of movement.
Right.
So early in the morning, you go to the doctor and he says, you have got hyperuricemia, you have got gout.
Oh gosh.
This is arthritis due to hyperuricemia.
Yeah. And hyperuricemia is when there is an excess of uric acid in the body.
As Dr. Irfan,
in the blood.
As Dr. Irfan has already said.
Yes.
Normally, the uric acid is present in everybody. Uric acid is produced by normal day-to-day, what you call is metabolism in the body.
Yes.
The new cells are being formed, the old cells are being broken, and they are producing uric acid.
Yes.
So
it's just a byproduct of being alive.
Yeah, it is byproduct of being alive. But there is a system. That system continues on excreting the excessive uric acid, which doesn't, the level which doesn't harm you, if increases more than, that system activates and that excretes the uric acid through your urine or through your gut.
Okay, so the gut is the thing that is sort of...
Urine is the thing.
Urine is the main thing.
Okay, so that means that your kidneys have to be working properly, sort of in tip-top condition.
Yes.
But that's only for urate, isn't it?
No. Both of them are present in the kidney.
Right.
If your urine is acidic, then uric acid will form.
Okay.
If your urine is alkaline, you see 7 is the median pH.
Yes.
And anything below 7 is acidic.
Right.
Anything above 7 is basic or alkaline.
Yes.
So if you have urine which is acidic, I'll give you an example. If somebody has a pH of 7 in the urine,
which would be quite ideal.
Which should be ideal. So they will be able to have 200 milligrams per deciliter of urine, of uric acid in a soluble form.
Okay.
But if somebody has a pH of 5.4, the same 200 milligram per deciliter goes down to 15 milligram per deciliter.
Oh.
So the 185 milligram per deciliter of the uric acid will be in the form of crystals which are not soluble.
Oh, okay. So what was ordinarily in a more alkaline environment, more uric acid is being excreted. But if it's acidic, then in the urine, basically, some of the uric acid goes in, but most of it goes back into your body and starts becoming those cheeky crystals.
Yes.
Oh gosh.
So having acidic urine is one of the most important factors of having high uric acid.
Okay, so it's one of the sort of, it's an easy way to tell that something is not quite right.
Yes, you can do a simple urine test, which is known as a urine complete examination.
Yes.
In that you can find out that there are, the pH of the urine is whatever it is. And if it is acidic, you need to alkalinize the urine.
Right.
If you alkalinize the urine, you'll be taking the uric acid from the insoluble form into the soluble urate form.
Right. And there's a great deal of conversation also now about alkaline diets, because alkaline diets are just, it's just generally better for the body to be in an alkaline state.
That's difficult to say. That's difficult to say because the normal homeostasis is when the pH of the body is 7.35 to 7.45.
Yeah.
So it is slightly alkaline. So yes, in a way you're right. But there are certain conditions in which you need to promote acidic urine to get rid of some certain infections which propagate in the alkaline urine.
Because acid is also killing bacteria.
Yes.
So it's a really delicate,
it's a delicate balance that you have to keep. But for strictly talking about uric acid, I've just told you that 200 milligram is soluble in a pH of 7 and only 15 milligram is soluble in a pH of 5.4.
Right. And what if it's too alkaline?
Then,
is it possible if it's like 9?
No, that's very unheard of.
Okay.
But yes, 7.5, that is possible. And basically it is present in infections. Somebody who has excess of phosphate in the urine, or somebody who has recurrent infections, then that takes your urine towards the alkaline side.
But it's impossible for your urine to be extremely alkaline.
Yes.
It's easier for it to become acidic.
Yes.
Right. So what are things, and I know that in terms of bone inflammations and inflammatory conditions, it is preferable to try and alkalinize your body. But then what causes acidity, what causes it to flare up in the first place? Why do we get so acidic?
This is a very different thing. Dr. Irfan has used the word homeostasis.
Yes.
Which means there is a normal condition which nature has made.
Yes.
And the pH in points matters a lot. You cannot say that his pH is 9.
Yeah.
Because the normal level is 7.35 to 7.45.
Yes.
And if it's
that tiny
any tiny change, that matters a lot.
The whole system gets thrown off.
Yeah, the whole system gets.
I would just like to clarify, what the pH I'm talking about is the urine pH, not the body's pH.
Okay.
But
I'm generally wondering.
Even for the body,
as a curious person,
change in micros matter.
Yes.
Okay, but does the body generally how acid, or what's the pH of the body in general?
That is it, 7.35 to 7.45.
Okay.
Answering your question in a different manner, people who eat a lot of red meat, shellfish, trout, cheese, butter, purified wheat and lentils, these are the people who will have a more acidic urine.
Okay.
Or more.
So all the delicious things in life will make you, contribute to your acidity. So red meat and lovely, white rotis. Okay, we're just going to cut to a very quick break and come back soon and talk more about uric acid. So see you in a minute. Hi, welcome back to the coffee table. Now that I've had a nice little cough during our break. Flu season, what is one supposed to do? Okay, so we're still talking about uric acid, and we're talking about diet, and we're talking about all the delicious things that make us acidic, and one should probably be avoiding in life. So Dr. Irfan, you were telling me about how red meat and lentils and purified flour, refined flour.
Yes.
These are all things, and cheese, also
Yes.
cheese. Cheese has betrayed us. I love cheese. But so basically, if you eat a lot of these, a lot of our bodies, the balance of our body and our homeostasis is dependent on where we are eating.
Yes.
That would be correct to say. So in terms of uric acid and hyperuricemia, we need to be careful about what we're eating.
Yes.
But then, how does one know that one is entering the danger zone for too much?
The predisposing factors, as you say, will be somebody who has the metabolic syndrome, somebody who's grossly obese, has a BMI of 34, 35, something like that, somebody who's diabetic, hypertensive, or somebody who has a problem with their thyroid. These are the problems. These are the people who are predisposed to develop hyperuricemia as well. Especially patients who are hypertensive using diuretics, such as loop diuretics. You must have heard about a medicine known as Lasix.
Yes.
Thiazide diuretics. People who are diabetics and using insulin. These are the patients who are at a high risk of developing hyperuricemia as well. The diet that I was talking to you about was, this is not only for acidic pH or something like that. It is also the same diet which will make you.
I would like to interrupt Dr. Irfan.
Okay.
There are so many other people who are likely to have this hyperuricemia.
Right. So it can happen to just about anybody.
It can happen to anybody, but those who are meat lovers, especially red meat lovers, but those who are alcohol lovers, especially those who are more prone to take beer. Beer has more effect in metabolism and creates hyperuricemia as compared to alcohol. And those who start extensive dieting.
Oh, so being obese is also problematic, but also too much dieting is also problematic.
Excessive dieting.
Excessive dieting.
Excessive dieting is also, starvation is a problem.
Starvation is a problem.
If you keep yourself starved, your uric acid will increase.
Oh, again, so it's really about balance, isn't it?
Really about balance.
Basically,
so you can't be overweight, but you shouldn't be underweight.
Basically,
either.
it is a product of breakdown of cells. So when you are starved, your cells start breaking down.
Yes.
And there is an increased uric acid level in your body.
Oh, because again, if the acid is a byproduct of your cells generally doing their normal, sort of wear and tear, but now you're forcing the body to do more of it.
Yeah.
Even if it's fat cells?
Every cell.
Every cell.
Every cell has a nucleus.
Yes.
Nucleic acids are a part of every cell.
Right.
And this uric acid is a product of degradation of purines.
Yes.
Which are nucleic acid.
Oh, so purines are nucleic. A purine is a nucleic acid, and nucleic acids are in the nucleus of a cell. All my O-level biology, I remember it. So, if one is in this kind of well, I'm just going to, as a layman, say danger zone, because I like the sound of it. So if you have a thyroid condition, if you are diabetic, if you are taking diuretics, if you're in that kind of area, if you're dieting too much, if you've become excessively skinny far too fast, so what should one be looking out for?
Basically, adequate hydration. Adequate hydration in terms of your urine output. Now, you must have heard that somebody says 6 glasses of water in a day, 8 or 10 or 12. It's not really about that.
Okay.
It's about your urine output.
I'm not very good at it.
See, somebody who's in an air-conditioned environment will need less water. Somebody who's working out in the street will need more water. So it is essentially somebody, you're in a safe region when you urinate about 2 liters in a day.
How do you know it's 2 liters?
Normally, when you urinate, you pass around 300 to 500 ml.
Okay.
So if you pass a good amount of urine 5 to 6 times in a day, you're there.
Then you're probably okay.
So if you're passing that much urine in a day, then most of the end products of everything, including uric acid, will be taken care of.
Right.
Now, just as Dr. Khalid mentioned, breakdown of all the cells, especially in patients who are receiving chemotherapy, who have myeloproliferative or lymphoproliferative disorders, those patients who are having cell death due to chemotherapy, these are the patients who are more predisposed to develop a thing which is called as hyperuricemia.
Yes.
So that is another end of the story. So basically a healthy lifestyle, keeping you back from fructose, which is present in soft drinks, in your boxed juices, and keeping you back from refined diets like pure white atta, and having whole grain diet, whether it be bread or
so lots of fiber.
flour, yes, and eating a lot of fruits and vegetables, that will keep you in a safe zone.
Okay, that's comforting.
They usually say that taking excessive proteins,
yes,
that causes hyperuricemia.
Oh, and because there are diets, where you're like
the Atkins diet.
Exactly, and you're sort of high protein, low carb.
Yes.
Yeah.
So that.
But if you compensate your proteins with low fat dairy products.
Okay.
Yes.
Low fat being key.
Low fat.
So not cheese.
Yes.
Low fat
Definitely
dairy.
not cheese.
But like yogurt.
Low fat dairy.
Low fat.
Skimmed milk.
Yeah.
Skimmed milk yogurt.
You can compensate yourself, your proteins level with that.
And no cheese.
Anything which tastes good is not good for you.
I'm feeling really sad now. Dr. Khalid, you also mentioned that now sort of steering it back to bones and uric acid and inflammatory conditions like gout. There is also women, post-menopausal women are also at higher risk to develop these kind of conditions.
Yeah.
Why?
Because they say that this estrogen usually protects the woman from hyperuricemia.
Oh, so it's like estrogen is like, poof.
Yeah. And when after menopause, estrogen levels are decreased,
Yes.
they become
Bones become more vulnerable.
Good target to
Oh dear.
uric acid
Oh, God.
hyperuricemia.
So postmenopausal women also should be doing all of this sort of hydration.
In postmenopausal women, there is a lot of metabolic changes.
Yeah.
Because you must have heard osteoporosis.
Yes.
That's more in postmenopausal women because of breakdown of products of bones and etc. So in postmenopausal women, the chances of hyperuricemia are more as compared to premenopausal. Men between 30 to 60, 65 years, they are more prone to hyperuricemia.
Oh, so that's basically most men.
Yeah.
30 to 65 is a very big range.
Yeah.
Wow. So, well, some benefits of being a woman, I suppose, till you hit menopause. Okay. So men are generally more prone to inflammatory arthritic conditions generally than women are.
Men are more prone to gout as compared to women.
Okay. So can you tell us what gout is? Because, to my mind, it sounds very Victorian, gout.
Gout is a kind of arthritis.
Okay.
Inflammation in the joint. And the reason for that is presence of uric acid crystals in the joints.
So spiky crystals.
Spiky crystals, they collect there. And when they collect there, they invite inflammation. And there is a redness, there is increased temperature,
because
there is
really
loss of movement.
Having like a little knife sitting there stabbing your tissues all the time.
Exactly.
And you know what
It damages the cartilage.
Even cartilage gets damaged, even though it's quite sort of one thing of cartilage is quite resilient.
There is another story. Uric acid is being produced in the body at every moment.
Yes.
And that usually is collected in connective tissues and in cartilage.
Oh,
and
okay.
that doesn't
as a
harm.
normal procedure.
As a normal procedure. And that doesn't harm. But whenever there is an injury, that stored uric acid crystals, they come out of the cartilage or connective tissues.
Oh, okay.
And then they start hurting.
Oh dear. So they're sort of ordinarily they're kind of tucked away inside tissues. And if you twist your ankle,
you might have heard that uric acid level between 4.5 to 7.5 is a normal level.
Okay.
Which means this much uric acid is always present in the body.
And this is just like a normal standard to be within this range.
When it increases from this level, that starts accumulating in the form of crystals in various joints.
But that's also interesting that trauma to any of these areas releases it as well.
I have seen so many patients. They come to me, they get their uric acid, they come with the pain. They get their uric acid done. They have uric acid 5 and still he is painful. Because this is 4.5 to 7.5 is a range. It can be valid for some patients, it cannot be. And I have seen patients who came for some other reason. I got his uric acid done and that was 10.
Oh, and they were fine and there was there were no symptoms.
He didn't have any problem.
Wow. So is it if you have a high sort of level of uric acid, but you don't have any pain or any kind of inflammation or at least no apparent symptoms, then it's all right. You can just carry on.
People carry on. If they come to me, I advise them to take all precautions and bring it down. But outside we were sitting and we were discussing that patient has a diabetes. He doesn't know he has diabetes.
Yeah, that's also true. A lot of times you are unaware of the condition.
Because diabetes doesn't cause pain.
Ah, yes. And we're not really in the habit of getting checkups for no reason.
It is the pain which brings the patient to doctor.
This is true. And we're just going to cut to a very quick break and now talk about prevention and cures when we come back. Stay with us. Hi, welcome back to the coffee table. We're having a fascinating conversation about uric acids and all the terrible things it does to our body. But you know, if you're sensible, you'll be just fine. So I'm Dr. Irfan. Speaking of terrible things, uric acid also interferes with your kidneys to a great extent, I believe. Yes. And you can get kidney stones from uric acid?
Yes.
Is that the main reason for kidney stones?
No. Actually, there are many types of kidney stones. If I talk about the major types, there are 6 types.
Okay.
And even if I include the minor types, there are 16 types.
Okay.
So uric acid is one of the important types.
Oh, so it's one of the 6, the top 6.
One of the 6.
Okay.
The more important thing about uric acid stones is they are not visible on X-ray. So kidney stones are of 2 types. Some which are visible on X-ray, the others which are not visible on X-ray.
Okay.
So uric acid is not visible on X-ray.
Sneaky.
So, yeah.
Sometimes there's crystals and you can't see them on an X-ray. So how can you find them?
The best test to do for kidney stones is a CT scan, a non-contrast enhanced CT scan. So pure uric acid stones are very hard to find.
Okay.
And most of the uric acid stones occur in combination with calcium or oxalate or phosphate. So pure uric acid stones are difficult to find, but if you find a pure uric acid stone, this is the only type of stone which can be, you can give a medicine and they can get dissolved.
Oh, so you don't have to blast them with a laser or anything. No. Okay.
But that is only for the pure uric acid stones.
And those are very rare.
Those are rare.
Right. But is it possible to have so many of them that it could cause sort of serious distress?
Yes. If somebody has a very large stone in the kidney, which is pure uric acid stone, then you see the kidney is damaged when the outflow of the kidney is blocked by a stone.
Okay.
So if there's a very large stone in the kidney, or even if there's a tiny stone stuck in the ureter, which is the tube which is taking the urine from the kidney to the bladder. So even a tiny stone in the ureter will cause you severe pain, and it can also damage your kidneys.
Yes.
So the important thing the message that I would like to give is that whichever type of stone you have, if it is in the ureter, you must get it treated urgently. Because in the first 2 weeks, when the stone is blocking the kidney, the first 2 weeks are safe. But after that, if the nephronal damage occurs, it is permanent.
So one knows about stones because of a decrease in urine output?
No.
Or does it hurt?
No, the urine output usually stays the same because you have 2 kidneys usually. There are people who are born with 1 kidney, but usually most of the people have 2 kidneys.
Yes.
So the urine output would stay the same. Nature has made the mechanism, God has made that mechanism that if 1 kidney is obstructed, the blood is diverted towards the better kidney. So the urine output stays the same.
Okay, so you can't really tell that way.
No. The patient will present with severe pain, which is originating in the back and then radiating down to front to your urinary
Because the kidneys
passage.
are at the back.
Kidneys are at the back.
Okay. See, anatomy lesson also.
Yes. So the patient will usually present with the pain, and the pain is very severe. The renal pain is right up there with myocardial infarction. It is that severe. Can cause,
or labor.
Yes, definitely.
He has no experience.
That's why I would pipe in and say heart attacks, renal pain, labor.
So,
it really hurts.
So that is what brings the patient to the doctor, the severe pain. Now you can treat the pain with some analgesics, but the bottom line is that it should be treated urgently, and whatever the treatment option you take, it should be finished within 2 weeks of the first pain. So if people delay their treatment for months, and that is what gives rise to chronic renal disease, in which the kidneys do not function then.
And then one could even then just collapse the kidney, and then one could get a transplant.
Yes.
But transplants are fairly sort of happening now in Pakistan. Yes. It's developed the procedures, and is it safe?
Yes, transplant is obviously a safe procedure, but you see, prevention is always better than cure.
Quite right.
And transplant is a good alternative to dialysis, But obviously, somebody who's on dialysis or has a transplant has a good quality of life compared to somebody who has renal failure. But comparing them to somebody who has a normal kidney, normal kidney function, you cannot compare the both.
Quite right. So everything is on this side and healthy renal function is on this side. And we were talking about prevention earlier off camera, and you mentioned something about being consistent with the medication that you're expected to take. Because a lot of people are prescribed medicine that you need to just take maybe forever for the rest of your life, and people then stop taking it because they decide they feel better, so they just stop taking it.
Yes, that's a dilemma. That's a problem in our society. People will take blood pressure medicine when they have headaches or when they have nausea or they have they think they're not well. Or when those feelings are not present, they'll stop taking their antihypertensives. People will stop taking their diabetic medications when they feel fine. If they are going too frequently to the washroom, they'll start using their anti-diabetic. Similarly, for uric acid, people will stop using these medicine when they feel fine. That is a wrong thing to do because somebody who has a problem in their uric acid metabolism will continue to have that.
Right. It just doesn't, you can't cure it. It's just now a condition that you have, and you have to be serious about medicating it.
Yes. Right. You have to control it. Once the uric acid deposition takes place, the tophi form, it's very difficult to get rid of them. So Dr. Khalid will be in a better position to discuss about that. But once you are diagnosed with hyperuricemia, you have to comply with what your doctor tells you. You can't just take the medicine for a month and then leave it.
Yes.
Dietary precautions are good. You can obviously have a healthy lifestyle. You can obviously have, what I was saying, adequate amount of water and everything. But unless you comply with what your doctor recommends for you, you're bound to have problems.
Please listen, everybody watching this show. If you are supposed to take your medicine all the time, do it. This is a public service announcement. Dr. Khalid, as an orthopedic surgeon, when tophi form and you have an arthritic condition, do you think that people are having these kind of issues more because now our lifestyles are more sedentary and we're sitting behind our desks at computers? Do you think that makes us more vulnerable to kind of, like tophi formation?
No. It's not like that. Tophi is a very late stage in hyperuricemia. Before tophi forms, there is a kind of arthritis which alarms the patient and which takes the patient to the doctor who treats him. And the treatment of this hyperuricemia is different steps. I have told you predisposing factors.
Yes.
So number one, you need to prevent that factors. Your diet, your protein intake, your fat intake, your drugs. You need to, your alcohol or beer. The first thing is prevention. Then there are a lot of medicine because there are 3 stages in the gouty arthritis. One is arthritis, which is inflammation, which is redness, which is hot, which is pain.
Which starts with your big toe.
So the first treatment is treatment of that arthritis, which are anti-inflammatories, which are pain medications.
Does exercise help?
Exercise helps. And the second line of treatment is, I have told that the uric acid production is increased in some patients. Excretion is normal, uric acid production is increased. Yes. So the second step is to stop the production of uric acid.
Right, or to sort of try and bring it into a normal range.
There are drugs which decrease the production of.
Right. And you have to take them consistently.
Yeah, and you have to take them consistently and monitor your uric acid.
Okay. So monitoring is also important.
Regular intervals. And then there are drugs which cause increased excretion of uric acid.
Oh, that's handy. That's nifty. It's nice to know.
So these 3 types of drugs are necessary for the treatment of uric acid.
So these are
the treatment of uric acid, the surgery has a little role, but the surgery is there when the tophi are formed. There is increased inflammation, there is ulceration due to these tophis, then they are curated out.
Oh, so you can just kind of go in and scrape them out.
Well, exactly. You can go and you can curate them out.
Tophi can be
and then take the drugs.
And then take the drugs. So it's not really possible to treat uric acid related conditions, especially ones that are causing arthritis, with just diet. Like you have to take the drugs. You have to take the medicine. So you can't be like, well, I've stopped eating red meat and I don't eat any cheese and and now I'll be fine. You need to take the medicine. Like
when you are in fact taking good precaution, you need to monitor.
Right.
That where is your uric acid level nowadays, and you must take medicine accordingly.
And if anybody can be sort of vulnerable to this, if you don't have any of these conditions, if you're just a sort of regular person with normal health, but it is a good idea to maybe have a yearly checkup or a yearly blood screening to see if your own levels are regular.
You can.
Yes. In the Western countries and in the developed world, after 40, they have strict schedules in which health screens are being done at different intervals, like at 40 and then after every 3 to 5 years, and then after 50 every 2 years, and after 60. So all those protocols have been developed because certain diseases can, due to the epidemiological incidence, those are prevalent in those countries. Unfortunately, we do not have any epidemiological data which would generate our own local guidelines as to at what age we should do. But essentially, at 40, you should have a general health screen. And then accordingly, your family physician can tell you how to manage your screening later on.
Okay, so after 40 is when one should be sort of keeping an eye on these things if you don't have any of the other danger zone preconditions. Okay, and what about athletes? If you play a lot of sports and if you are kind of in a situation where you can't be causing trauma to your joints, is that also an incidence where you should be looking at your uric acid?
I think regularly they don't need to.
Okay.
If they have a problem, they start having pains, because when they are exercising, their body is tuned up to keep the homeostasis is a condition which remains. The body tries to keep that condition in every condition.
Clever body.
Nature
it's working hard, so you're causing it to go up and down, but the body is self-correcting.
If you are using one system more, the other system comes along with that. To remove the byproducts of that excessive exercise. So usually they don't need that.
So in a sort of regular situation, the body is trying to keep homeostasis static. And if one is generally, you have a good diet and you are drinking enough water and you're sort of making sure you're not overweight, then generally, as far as uric acid is concerned, we are okay. Not too many fizzy drinks.
Yes. General health principles are nearly the same for every disease. Not too much fat, not too much soft drinks and sugars, not too much fructose, and not too much red meat.
Okay. And cheese. Because I'm stuck on cheese and beer.
I can tell you one more thing.
Yes.
Drinking a lot of coffee, which is 4 to 5 cups in a day, has also been shown to reduce hyperuricemia.
Yes!
One interesting fact.
Yes, excellent.
That's 4 to 5 cups of coffee a day.
Oh,
That's a
wow.
lot.
That's good. So this is one good news that I have been given, that you can't have, don't eat too much cheese, but you can drink your coffee. So, huzzah! Thank you so much, doctors, for being on the show with me today and giving us so much information that is extremely vital and super useful. And I'm sure all of you have had a wonderful time listening to the show. Drink your coffee. If you're watching this on YouTube, don't forget to like and subscribe, and we will see you next time on the coffee table. Bye now.